What if the most profitable business strategy in American history wasn't innovation, wasn't disruption, wasn't some genius idea cooked up in a Silicon Valley garage? What if it was just a lawyer, a patent filing, and a decision to never ever let a drug go generic? Buckle up. Because what AstraZeneca did with a little purple pill called Nexium is one of the most brilliantly dirty legal moves in the history of capitalism. And here's the kicker. They didn't break a single law. Let's go back to the late 1980s. AstraZeneca has a blockbuster drug. It's called Prilosec. It treats acid reflux, heartburn, the kind of stuff that half of America deals with every single day. By the 1990s, Prilosec is pulling in over $4 billion a year. $4 billion annually for a heartburn pill. It's the best-selling drug on the planet. But here's the problem with patents. They expire. And when a pharmaceutical patent expires, generic manufacturers can swoop in, copy the formula, and sell it for pennies on the dollar. Which means AstraZeneca's $4 billion golden goose was about to get cooked. Their patent on Prilosec was set to expire in 2001. The clock was ticking. Generic competition was coming, and the suits in the boardroom were sweating. So what do you do when your most profitable product is about to become worthless? You don't innovate. You don't invent something new. You just tweak it. Barely. And then you patent the tweak. Here's the science, and I promise I'll keep this simple. Prilosec, the original drug, is what chemists call a racemic mixture. That means it contains two mirror-image versions of the same molecule. Think of your hands. Left hand, right hand. Same structure, just flipped. Prilosec had both the left-hand and right-hand version of its active molecule. AstraZeneca's chemists basically said, what if we just removed one of the hands? What if we only used the left-hand molecule? They called it esomeprazole. They slapped a new name on it, Nexium. They painted the pills purple instead of orange. They filed new patents. And they spent over $500 million in direct-to-consumer advertising telling Americans that this new purple pill was a revolutionary breakthrough. It wasn't. Not really. Studies, including ones funded by independent researchers, found that Nexium performed only marginally better than Prilosec in most patients. Some studies found no meaningful clinical difference at all. One Harvard researcher famously called it a classic example of a Me Too drug dressed up as a miracle. But here's where the strategy gets diabolical. AstraZeneca didn't just launch Nexium. They actively killed Prilosec. They stopped promoting it. They let it go over the counter, basically training consumers to see the original drug as cheap, generic drugstore medicine. Meanwhile, they repositioned Nexium as the premium, serious, doctor-prescribed solution, the purple pill, the real deal. Doctors started prescribing Nexium by the millions. Insurance companies were paying $15 to $20 per pill, when Prilosec was sitting on pharmacy shelves for pennies, the exact same mechanism, treating the exact same condition. This strategy even has a name in the pharmaceutical world. They call it evergreening. You take a drug that's about to lose patent protection, you make a minor chemical tweak, you file new patents, and you buy yourself another 20 years of monopoly pricing. It's been used dozens of times across the industry. But AstraZeneca pulled it off at a scale that made everyone else look like amateurs. By the mid-2000s, Nexium was generating over $5 billion a year. It became the second best-selling drug in America. AstraZeneca made over $40 billion off this strategy over the life of the patent. $40 billion from a molecule that was, functionally, almost identical to a drug that had already existed for over a decade. Now, was it legal? 100%. Patents exist. Minor chemical modifications qualify for new patents under U.S. law. Marketing a drug is legal. None of this was fraud. None of this was a crime. But was it ethical? That's where it gets complicated. Because while AstraZeneca shareholders were celebrating, American patients and insurance companies were paying billions of dollars extra for a pill that wasn't meaningfully better. Hospitals were blowing their budgets on Nexium prescriptions when Prilosec, or eventually generic omeprazole, would have done the same job. Some estimates suggest the American healthcare system was overcharged by tens of billions of dollars because of this single strategy. And AstraZeneca wasn't alone. Abbott Labs did it with antidepressants. Forest Labs did it. This became a playbook that the entire industry quietly adopted. If your drug is about to go off patent, you find the tweak, you file the paperwork, you flood the airwaves with ads, and you reset the clock. Here's what makes this story so compelling from a pure business strategy perspective, and so unsettling at the same time. AstraZeneca didn't win by being smarter scientists. They won by being smarter lawyers and smarter marketers. They understood the system better than anyone else. They found the gap between what's legal and what's right, and they drove a $40 billion truck straight through it. There's a lesson buried in this story that applies way beyond pharmaceuticals. The most ruthless competitive advantages aren't always technological. Sometimes they're structural, sometimes they're legal, sometimes they're just understanding the rules of the game better than your competition does. And exploiting every single inch of gray area available to you. Now, I'm not here to tell you whether that's good or bad. That's above my pay grade. But I will tell you this. The next time a pharma company releases a new and improved version of an existing blockbuster drug, right around the time the original patent is expiring, you'll know exactly what you're looking at. If this video opened your eyes, subscribe, because we're just getting started. Drop in the comments which corporate strategy you want me to expose next. See you in the next one.